Hello, my name is Lexi Adkins. I am going to be talking today for discussion 3, talking about today's healthcare system. Specifically, I'm going to be focused on better nurse-patient ratios. So just to get started, I know we'll work in the nursing field. We all kind of know this is an overwhelming issue. It has been for a long time, and I'm sure most of you have to deal with this at your workplace daily. I know I do, and I think that this is a global issue. And I just want to start off by reading a quote. I was doing some research trying to find some better outcomes if we do get this fixed and what that would look like. And I found this research article that specifically focuses on night shift nurses. And I know this is also for day shift, but this one specifically is for night shift. And how the nurse-patient ratio really does affect not only patient outcomes but nursing outcomes as well. It states staffing with fewer nurses at night increases the risk of complications. It also is during these hours that the number of ancillary staff, such as hospital secretaries and hospital housekeepers, are at their lowest, leaving nurses to take on extra duties, further increasing extensive responsibilities. So I kind of want to talk about this because I think a lot of the other issues that are around nurse-patient ratios have been talked about before. But I do think that we kind of overlook the issue of other places having the same understaffing issues, basically is what it comes down to. I know I work night shifts still, and this is an issue for me all the time. You get to the middle of the night, and we have less housekeepers, we have less people helping us, nurse care techs, there's less of them, there's less of us. It's just all the way around less staff. And I think that leaves us who are working with a little bit more responsibility. I work in the ER, and so if we've got a high patient numbers and there's not a whole lot of staff, we're all kind of just picking up extra responsibility to try to make up for that. And this can lead to all kinds of stuff. Nurse burnout. It's hard working in those conditions. It's hard keeping that up and not being burnt out from that. Patient outcomes. It can definitely have something to do with these ratios and understaffing issue. It can even go into higher mortality rates. There's multiple places online, multiple studies have shown that nurse-patient ratios, if they're too high, can lead to increased mortality rates. And also, we have a license on the line that we need to protect. These nurse-patient ratios being too high, if we don't stand up for ourselves, we're putting our license on the line a lot of the time. We have to keep that in mind. Negligence and malpractice lawsuits, medication errors, patient safety errors, all kinds of things can happen whenever you're overworked and understaffed. And I think that this is an issue across the board that needs to be talked about more often. So some changes that we can make happen to improve the system is to change how often we're hiring new grads and new nurses just in general. I know in the ER we hire twice a year, right around graduation time. So we are getting ready to hire more nurses to start this summer, and then we do that again in the winter. I think that this is a good system because it breaks it into two groups. You're not hiring just once a year or twice a year, kind of gives your nurses who are training a break, gives management a break, but I don't think it's enough. I don't think that we're hiring enough. I think that if you space these hiring groups out to maybe 4 times a year, so quarterly, that it would give your staff enough time to train these new nurses and to really spend time training them in everything that they need to know. My orientation and ER orientation for us is up to 6 months. Mine was about 5. And I know that sounds like a really long time, and I remember when I started it felt like an eternity, but honestly it just, you get off orientation, you still feel like there's some things that you need refreshers on because you haven't seen it in months. Or I was watching another video and somebody talked about ECMO. On orientation I saw that one time. So I think that that's something that we really need to talk about more, is training nurses, especially right out of nursing school, who don't have any type of nursing experience, to give them the opportunity to have as much time as they need on orientation and not feel like they have to come off for the next group of nurses to start. And I think the first thing we can do to make that happen is to hire them more often. And that's talking a little bit about the new grads. I also want to talk about the nurses who are training these orientees, so the preceptors. I know that they and at least in the ER, a lot of nurses have orientees pretty much all the time. By the time one of them gets done, they're already on to the next group of new nurses who need to go through orientation. So this is something that if we hire more often can maybe take the load off of that, because there won't be as many new grads being hired at the same time. So some of these orientees and preceptors can kind of have a break. Especially the preceptors can maybe have a break for a few months from having an orientee, can just focus on their nursing career, not having to train someone else. This new and improved system, I think, can increase patient satisfaction, mainly because that goes back to your nursing satisfaction as well. You know, these nurses are going to be less burnout, less turnover rates, higher satisfaction on their part, which can in turn make higher satisfaction for our patients, and less errors as well. You know, less burnout is better for nurses just in general, just nursing staff in general, because it just helps with the morale of the department. It also can increase retention rates as well. So, you know, once you put these nurses through orientation, especially if it's months and months, and it's an extensive training period. You know, once you get them through that, they're there, and they're there for a long time. They're willing to work for a while, and they're not thinking about the next place to go, because they're happier where they are. They've got the training they need to be there, and they're confident in their skills to work that department. So I think these are just a few things that we can focus on to try to better our nurse-patient ratios, better patient satisfaction, better nurse satisfaction as well. You can see the difference if we implemented these changes. You can see the difference in doing surveys, which I know UK does these a lot, and I think this is a great way to really see the difference that your changes are making in the system as a whole, especially in your department, because every department's different and requires different things. So I think that doing surveys annually or even more often can really allow us to see that the changes we are making makes a difference.